Thanks very much, Catherine. My name is Stephen Palmer. I'm the Managing Principal at the Texas Office for Health Management Associates. Thank you all very much for coming today. It's great to see everybody. I think we're going to have a great day of conversation and ideas. It's my pleasure to introduce Michelle Alletto, the Chief Program and Services Officer for HHSC.
I paid a couple people $20 to do the woo. Good morning. I'm happy to be here with all of you to kick off the 2024 Texas State of Reform Health Policy Conference. Today, you'll hear from healthcare leaders, policymakers, stakeholders, hopefully consumers, and me. All of us interested in helping improve the health and well-being of our neighbors. State of Reform is once again bringing us together to discuss critical issues facing Texas. As you heard, there is a packed agenda with panels on mental health, maternal health care, addressing workforce shortages, children's health, and the impact of AI on healthcare, just to name a few. I'm reasonably tech savvy, but if y'all figure out the whole AI thing, please get back to me, let me know. By meeting here, we are putting our heads together, sharing ideas and best practices, and in the end, I hope, working to move the needle in the right direction. It's inspiring to imagine that a conversation today could change care tomorrow. At HHSC, our vision is to make a positive difference in the lives of the people we serve. The majority of the programs I lead and support at HHSC serve Texans in some of their most, if not the most, difficult time. We work hard to ensure that with the more than 200 programs we administer, the 7.5 million Texans we touch every month move a step closer to thriving. Every day, our 40,000 plus team members across Texas work to carry out our mission. I think I have some of our team members here today. Can you raise your hand, team? Don't be shy. They're a shy bunch. Thank you. Many of you know that our agency manages Medicaid, the joint federal and state health insurance program for eligible low-income individuals. Over the past year, our agency has been redetermining eligibility for over 600 million Medicaid recipients. We're wrapping up this federally required effort very soon to ensure that those who are eligible remain enrolled. It's a huge undertaking for our agency and for all states. I'd like to acknowledge the over 500 ambassador organizations, many of whom are in the room today. Are you on our ambassador calls on Monday afternoons? All right, well, it sounds like we got some more people to add. Let's get to 600. These ambassador organizations have helped us reach thousands of recipients and their providers over the last year. Don't worry, ambassadors, we plan to keep you busy, and I'll get to that a bit later. I'd like to take the bulk of our time together this morning to highlight some of the work we're excited about, and I hope you will be too, and leave plenty of time for dialogue. I'd like to talk about some of our behavioral health continuum strategies, women's health services, and our early childhood and family support programs. As you know, Texas is a growing state and one of the largest in the country. I usually say we're just the largest, and I feel like that's fine in this room. HHSC was charged by the Texas legislature in 2022 to evaluate their investments and the effectiveness of our state mental health system. And we found, like much of the nation, our population growth and workforce challenges exacerbated already existing capacity challenges. That more support was needed for children and youth, particularly when they are in crisis, as well as preventing those crises from happening with early intervention efforts. And we needed more options for stepping up and stepping down from inpatient settings. To meet this charge, I pulled together our brightest team members to develop a roadmap that we hoped would inform policymakers. And thanks to the investments made by our legislature last session, we are well on our way, in partnership with many of you in this room, to expanding access to the state's mental health system and enhancing services along the continuum of care. What do I mean when I say continuum of care? We throw these buzzwords around a lot. I think this is an audience that probably has a good sense of what I mean. But when we think about it as Team HHSC, we think about all of the things leading up to an inpatient stay an institutional care stay, whether that's juvenile justice, jail, and we think about all of the steps that could happen along the way and should happen along the way to prevent that from ever happening. And then we think about that stay being as short as possible and helping people get back to their families, back to their communities, and thrive. I'm particularly excited about additional funding from Governor Greg Abbott and the Texas Legislature to expand treatment for adolescents and young adults. The numbers vary, but a juvenile judge court shared with me not too long ago that a child she sees in her court is 3 times more likely to be incarcerated as an adult. Reaching young people and their families before they become a part of the juvenile justice system or the child welfare system is our shared goal. Our state is stepping up our game in a number of ways, and I'd like to illustrate just a few. With $14 million in new funds over the biennium, we are creating 8 youth mobile crisis teams to support young Texans with behavioral health needs. This is a new program that's very similar to what you probably have heard about, which is our mobile crisis team. These specific trained professionals will provide in-person help to youth who are in crisis wherever they are, at school, at home, anywhere in their community. By creating these crisis outreach teams specifically for children and young people, we are, when possible, aiming to support youth and their families to stabilize and stay together safely. Cross-agency coordination on programs like this will be key, particularly working with children who have multi-layered traumas and significant health needs. For example, we have been working closely with our partners at DFPS to ensure these outreach teams are ready to assist children that are in their care. And better yet, working with local communities to wrap support around parents and families to hopefully avoid child relinquishment altogether. We're working closely with several other agencies and stakeholders to develop a Children's Mental Health Strategic Plan, the first of its kind in Texas, which will be shared with you all towards the end of the year. In the meantime, we would love to hear your ideas. When we expand access to care in community settings, we have more capacity in our state hospitals to serve patients that need acute care. More and more, we are serving justice-involved individuals in our hospitals. They represent more than 70% of our state hospital patients. HHSC currently operates 10 inpatient psychiatric hospitals throughout the state. Since 2017, Texas has invested $2.5 billion in our state hospitals to build state-of-the-art facilities and modernize our older buildings to provide more therapeutic and safe environments for our patients. I'd like to illustrate exactly what that means. Hopefully, some of you have a chance to visit one of our new campuses and take a tour. But I'd like to, for a moment, have you envision how many of you have seen some of our older state inpatient hospitals? Oh, that's perfect. How many of you have had a chance to tour or see the grounds at least or renderings of any of the new hospitals? Awesome. Well, you designed them, so you're cheating. Every patient room has a window. Almost every patient has their own room. There are wide, open, bright, therapeutic spaces, sunlight, sunlit atriums. I believe, as I said before, that our mission is to serve those most in need at some of the most difficult times in their lives. These new facilities are a testament to how much Texans care for one another. We are beginning to see the results of all of the hard work pay off. In February 2022, we celebrated the completion of a new hospital in Houston, the John Dunn Behavioral Sciences Center. Last year, we marked the completion of the new Rusk State Hospital, as well as Kerrville State Hospital's maximum security units. And I'm excited to share that over the next few months, we will also be marking the completion of the new replacement hospitals in San Antonio and here in Austin. Sorry, this is the downside of using an iPad for your talking points. But imagine if I had paper and I was flipping back and forth, that'd be terrible. I'm excited to share that over the next few months, we will, I already said that. Other projects in the work to modernize and expand are in Terrell, Wichita Falls, Harlingen, Amarillo, Lubbock, and El Paso. That is a lot of planning and construction work going on. However, we know that there is still a high demand for beds at our hospitals. The need is great, and construction takes time. We also know that there are multiple ways to meet the needs of this population in our communities right now. For example, the Texas legislature provided us with funding to contract for an additional 150 beds in communities where they are needed most. These beds treat forensically committed individuals that are waiting to go through the court process but first need their competency restored. As the state hospital system begins to stabilize, providing a strong backstop for individuals who truly need that level of intensive inpatient care, it's important to go back to the continuum once again. I think we have just scratched the surface of what we can do to prevent individuals from needing that level of care and how we can set individuals up for success when they are discharged. This past legislative session, Governor Abbott and the Texas legislature also entrusted the agency to provide hundreds of millions of dollars to expand mental health continuum resources through state and local partnerships, providing for locally driven solutions. Investments include increased funding for community-based mental health programs and justice grants, as well as funding for a new innovation grant program focused on providing community services to Texas youth. We are also increasing the number of sequential intercept model workshops. How many of you have you heard of sequential intercept mapping? Okay, well, essentially, it's kind of not self-explanatory, but essentially what we do is go to communities that are interested in bringing their judges, their mental health professionals, their justice agencies and experts together in a room to map the course of people with mental health needs that eventually end up interacting with the justice system, and how those communities help those communities figure out how they can intercept people that really have mental health needs, usually are committing lower level crimes and do not need to end up in jail, and if they do, needs to coincide with mental health treatment. Communities are clamoring for this type of service. We have a wait list to get out and do this sequential intercept mapping, which is very exciting for us. So next year, we will be increasing the number of workshops that we can offer to communities around the state. I could spend my entire allotted time today, don't worry, talking about the impact these resources will have and the importance of the continuum. I look forward to building strong relationships with our community partners and providers as we roll out these projects and examine what else is needed in the next legislative session to build a strong continuum of care that serves Texans. In addition to the tremendous efforts our agency has put forth towards strengthening the behavioral health continuum of care, we are also working toward implementing a policy game changer. I'd like to share a little news, if you haven't heard by now, that will help pregnant women and new moms. Beginning this Friday, March 1st, HHSC is extending postpartum coverage to 12 months for eligible Medicaid and CHIP recipients. Approximately 137,000 women will benefit from the extended postpartum coverage. We know that among high-income countries, the U.S. has the highest rate of maternal deaths. More than 50% of these deaths occur within 1 year of childbirth and are largely preventable. A full year of postpartum coverage offers women the opportunity to address any health issues that arise throughout that first critical year. I want to thank our state leaders for supporting this important measure through the passage of House Bill 12. Women will now be eligible to receive the full array of Medicaid services for that year: regular medical checkups, hospital care and services, x-rays, lab tests, vision and hearing screenings, and last but absolutely not least, mental health care. We have details on eligibility and tools for our ambassadors. I told you that we weren't done needing your help. Our team can connect with you today to make sure that you get those and are able to share them. As important as it is to support the health and well-being of women during their postpartum period, our work doesn't stop there. We're working to better support families on their journey as well. Some of you may know that the passage of Senate Bill 24 from last session has the prevention and early intervention programs moving over to HHSC from the Department of Family and Protective Services. PEI programs are focused on strengthening the support network for children and at-risk families. These vital programs, like home visiting, are locally driven and dovetail quite well with our more traditional mental and family health programs at HHSC. The goal of these programs align with ours and also serve children and families at critical junctures to help prevent and reduce behaviors that may lead to child abuse and neglect, delinquency, substance use, or involvement with the child welfare or juvenile justice systems, or as we believe, put families back on their paths to thriving. More than 66,000 families were served last year by PEI programs, and 96% of the children served remained safe from abuse and neglect. 2024 is going to be an exciting year in moving the healthcare needle forward in Texas. I'm excited for all of the discussions today, and I know you are too. Let's start the day. Thank you.
Well, thanks very much, Michelle. So we have time for a few questions. I have some, but I'd love to open it up to the audience to see if anybody would like to ask Michelle anything about what's going on at HHSC or otherwise. Any questions from the audience? Well, I'll just jump in then. Michelle, so
No questions? Perhaps if there's questions or comments.
you have feedback, anything?
There we go.
Can we get a mic over here?
Feedback, ideas, concerns, questions.
And please introduce yourself.
Thanks. Good morning. Phil Beckett with C3HIE, and thanks, Michelle, for that. I wanted to, I'm not a behavioral health provider or really work with it, but I really want to reflect on your work with improving mental health for support for kids. I really want to see that happen. I work a lot in San Antonio, and you look at a map of where the population that needs most Medicaid is and where behavioral health providers are, and they're like on opposite sides of the city. Access, reimbursement for behavioral health providers is low. You want another career if I want to make money. How do you envision balancing some of that out and attracting resources to those places where the need is highest?
That's a great question, and thank you for that. I have not seen that map laid out that way, but I would be interested in seeing that for sort of all of our service areas. What we know is that we have a lot of the right services in Texas. We don't have enough of them. And you're also talking about where they're needed most. That's a particular concern in very rural areas where we may or may not have any providers to serve populations that are in need. And we know that almost every county in Texas is a health provider shortage area. So it's something that we look at very closely. Also, I saw Dr. Lakey walk in. Hi, Dr. Lakey. And the Children's Health Consortium, who have an incredibly robust plan for enriching and growing our behavioral health workforce. Like I said, I think we have, and that I said this morning, we have a lot of the right things. I don't believe that we yet have them everywhere we need them, and at the level that we need them. So your point is a well-taken one. Over the next year, I hope that at HHSC we can continue to do those kinds of mappings like you're talking about. I think one of the other strategies that helps us are things like T-Chat that Dr. Lakey's group supports, where we can utilize the benefits of telehealth to reach people, particularly youth, and also our mobile crisis teams. We don't want to have to reach people when they're in crisis, but that's another example of ways that we're trying to bridge that geographical divide where we have it.
And we had a question over here.
Yes, hi. My name is Lori Batchelor. I'm with Children's Health System of Texas in North Texas. I thank you for your summary that you provided today. I have a couple of observations and questions. So one of the things that you shared with us is that there are 8 outreach teams for children's. I love that you're developing the outreach teams. I also want to recognize you said this is a beginning, and so I want to give that. 8 outreach teams might meet the need of Houston or Austin or San Antonio or Dallas, and so I acknowledge that beginning. So I want to give you an opportunity to answer that, but then I want to dovetail on this gentleman's comment as well. We talk a lot about tertiary care for behavioral health. How about preventative care? So we've got to get ahead of this. In my organization, we're collaborating with our School of Medicine, UT Southwestern, and building a behavioral health hospital. Our organization only had 8 beds at the time. We had to give those up because of the surge of the volume of patients during the pandemic. In this new hospital, we're going to be able to create 92 behavioral health beds for adolescents and young children, and then many more beds for adults. So thank you for answering those questions.
Thank you very much. And that is a wonderful amount of beds that you're able to bring on, particularly for, you said children and youth? For 8 mobile crisis teams, you're exactly right. In a state like Texas, it's not a lot. We think that what we can do with that money, that $14 million, and the 8 teams, is really prove the effectiveness of the model, and hopefully be able to get pretty quick data and impact. We have that for our mobile outreach teams for the general population. But for these youth mobile crisis teams, we haven't set them up yet. It's a brand new model. And so we are also partnering with DFPS to make sure that in areas where we have a high need in terms of prevention of child relinquishment, that these mobile crisis teams are also suited to provide that level of crisis care to families that are at a very critical juncture. So I think from these 8, what I would love to see is more coverage for our mobile crisis teams for the general population, and we do this through our local mental health authorities primarily. We don't have enough of the general population mobile crisis teams either. Our 24-hour crisis is really a hotline. It's 988, which is a wonderful thing, but even when we have a service area covered with a mobile crisis team, it doesn't mean they're 24/7. It doesn't mean that they can cover, all of the counties, particularly all the rural counties. So even on the adult side, we have a lot of room to grow. But I'm hoping that we can show the legislature that this model works.
Hi. Speaking of a crisis, I probably represent the 1% of the people in this room who are actually on the receiving end of a lot of these benefits. I have a special needs child who's on the deafblind multiple disabilities waiver program. I liked your quote about we have a lot of the right services but not enough. I know it's gotten political, but it's also about the money. Texas, unlike many other states, has not taken the Affordable Care Act Medicaid money, which would expand many of the waiver programs. There's a massive crisis and default in this state because the political leaders have not accepted that money. Correct me if I'm wrong, but there are about 15 years waiting to get on the class Medicaid waiver. There's 3 or 4 years for deafblind multiple disabilities waiver. Now let me let you know what that means. A child has to be considered deafblind and have other multiple disabilities to qualify. So Helen Keller, unless she had other multiple disabilities, would not qualify, and there's a 3 to 4 year wait list for that to get Medicaid. MDCP has, I think, 5 or 6 year, 7 year waiting list. Anyway, those wait lists are real. The other thing, talking about behavioral health care, and I have fought and died on this battlefield many times. Under the Star Kids handbook, it says that private duty nursing is to, under the Omnibus Budget Reconciliation Act of 1989, requires all states to provide all medically necessary treatment for correction or amelioration of physical or mental illnesses and conditions to THS steps eligible clients when federal financial participation is available, even if the services are not covered under the Medicaid state plan. One thing that I always note in there is medically necessary treatment for correction or amelioration of physical or mental health issues. Now, every time we deal with private duty nursing, of course the nurses are going to chart all the physical aspects of things, how many cc's they push, how much medications they give, those type things. I always have to remind them, because there's not training generally, for them to chart the behavioral aspects of my autistic child, the self-harm, the elopement prevention, the other things that they do constantly, and I've had to fight to get Medicaid hours or nursing hours provided for the behavioral aspects of things in addition to the physical things. And that should be on parity, and is not considered on parity with the physical things, having a trach, a G button, the other physical aspects of things. So please keep that in mind, and I hope in this upcoming legislative session, just more dollars given to you can help more kids out there. And if those Medicaid dollars come in, I don't care why they vote and do that, but that seems to be something that's very necessary. I think you would agree, you have a massive need for more dollars, and that is one way to get it. And I hope that people can advocate for that. Anyway, thank you.
Thank you.
Other questions from the audience?
Hi, my name is Diana Forrester. I work for Texans Care for Children. I'm going to shift over to the women's health postpartum extension you talked about going live on Friday. Yay! I was excited to hear the 137,000 number. They weren't able to share that on the ambassador call yesterday, so that's great to know. I just had a question for you. With Medicaid and CHIP, things that we consistently hear from families is like, once you can get it, it's great care. You can see doctors, you can get your medications filled, you can get those referrals you need, but the application process and the renewal process continue to be a pretty big barrier. And I'm sure that you have a vision for tiers and what you would love to see. And so I'd love to hear your thoughts on that.
I didn't ask her to ask that question. The 137,000 number, I asked the team to crunch last night for me. So it's an estimate, but I really wanted to be able to give y'all a sense this morning of the reach. And in a state like Texas, 137,000 doesn't even really sound like that many, but there will be many other women served through our Healthy Texas Women program as well. And so that's not the only way that women of reproductive age or after having a baby can get services. But to your question, the application and renewal process, I want to hit that one first. We are taking a look right now at our Healthy Texas Women application, and we've been working, I think this was one of the first things I heard about when I got here 4 years ago. And there are a lot of complexities to why we have, and our Healthy Texas Women program, for y'all that don't know, is a benefits package for women of reproductive age, basically around family planning, interconception care, preconception care. But it is not the full range of Medicaid services. So there's a higher FPL that you can, federal poverty limit that you can qualify for Healthy Texas Women than you would the full Medicaid array. So we are taking a look at the application because we offer a more robust set of services under Healthy Texas Women, our family planning Medicaid program, than some other states. We have a longer application. But if there's anything we can do to make that process easier and make that application simpler, we want to be able to offer that for leadership to make a good decision and provide us good direction on that. In terms of the application process as a whole, this postpartum benefit, HB 12, that's rolling out on March 1st, we've worked very carefully. I am concerned about women who have been, and you and I were talking about this last night, who were pregnant, had a child during the 3 years that we held Medicaid coverage for folks because of the public health emergency, who have who are sort of in the middle of this and have gotten messages about having to reapply, and now they'll get messages about postpartum coverage. If they fall within what would have been their 12 months postpartum, we are keeping them and enrolling them. But the messages and the outreach that we do is all above those standard Medicaid. I mean, many of you have seen them, the bulletins that people get in the mail. They're not the best. A lot of that's required for us to put on it, but we're trying to find ways, number one, to make those more consumer friendly. In the meantime, we're trying our best to get as many messages out. We have a very robust toolkit for HB 12 rollout, and we can make sure that you have that. It will be shared on the ambassador calls on Monday nights. Just plug in that, or Monday afternoons. The other thing about tiers, my belief is that a good eligibility worker experience is a good client experience. And right now, our eligibility workers who are still working 20 hours of mandatory overtime a month have several screens. It's it's a 20-year-old system. And we do our very best to keep it as up to date as possible. We are moving our tiers system. That's our eligibility system. So that's where if we're on a call and someone's submitting an application, all their data goes into that system. And that's how we determine eligibility. It kicks out eligibility determination letters, things like that. We have just moved that to the cloud. It was physically located. Where are my IT people in the room? Not mine, but just like generally. Yeah, so it was on a server that was physically located somewhere. It was like a box, a room, I don't know. And it would crash, get too hot, it would crash, in the cold it would crash. We've moved that to the cloud, thank God, which is like putting your oxygen mask on a data system. That will allow us, though, to make it more streamlined in the future. And so we are really going to try to do that, both so the eligibility worker can focus on the person in front of them and not so much the computer screens, and that we hopefully are able to process applications a lot faster.
So I just have one final question before we wrap up this session. You mentioned
Do we have to wrap up?
I'm afraid so.
Okay.
Yeah. You mentioned the maternal health toolkit. Could you talk a little bit more about that and kind of what that entails?
I can. So this really smart woman over here in the corner, Christine Mann, our communications director, can make sure that you all get the link to the toolkit. We have information that is client-facing about their benefits. Again, as I mentioned, women have had everyone in Texas, but women in particular, have had several benefit programs, the unwind of the PHE, and now postpartum coverage. It's really, really important that the right messages get out to women so they know that they are eligible and how they can apply. We also have messages for our providers because we know, particularly when we rolled out Healthy Texas Women and added some benefits to the Healthy Texas Women program, my TMA folks, where'd you go? There you are. It's one thing for the clients to know what their eligibility is, but providers really, really have to know. It's just as important. That's the time that many women would understand that they have another benefit available and apply. And so that's another big audience for the toolkit that we have. Am I missing anything, Christine, or is that primarily it? It'll be on our website.
Great. Thanks very much, Michelle.
Thank you, Stephen.
We're about to go into a day of panel sessions. I hope you all found your registration and agendas and can pick out some interesting sessions. With that, I'll send you all off. And can you join me in thanking Michelle for her comments today?
Thank you.